everybody, and welcome to another ICS podcast. My name is Shannon Wallace, and I'm on the ICS Education Committee and run our annual podcast. Every year, we put this on for our workshops that we're going to be running at ICS. And so we are really excited for Madrid in October. It'll be running from October 23rd to October 25th this year. And we have some great content, some wonderful speakers, and of course, some amazing workshops. So I'm really lucky today because I have a slew of experts in the field that have given up their valuable time to come and have a chat with me today about the workshops they're going to be putting on. So today I'm going to be talking about hands-on sacral neuromodulation with world-class experts, ideal lead placement. And so this is a workshop that is going to be running on Thursday, October 24th, and there are actually two sessions. So the first one is going to be from 9:30 to 11, and the second session is going to be from 11:30 to 1 p.m. So this workshop is a ticketed event with a space limit because you get to have an interactive session with these experts in the field. And so for that, the workshop is a little bit smaller, but no worries. There's going to be two sessions that you can sign up for. So without further ado, I'm going to introduce my wonderful panel here today. And the chair of this session is Dr. Hashim Hashim. If you want to introduce yourself. And he's here to talk about this workshop and then introduce the speakers and give us a little background. So thank you so much for joining me today. I so appreciate having you on with me.
Thank you very much, Dr. Wallace, for the kind introduction. It's a pleasure to be here and talk about our hands-on workshop at the ICS. We are going to be doing a hands-on training session on sacral neuromodulation. This involves 3 stations and as well as an initial introduction and some lectures by esteemed faculty from around the world who are experts in insertion and management of sacral neuromodulation. And we will be doing the percutaneous nerve evaluation. We will do a timed lead and full implant station, as well as a programming station. And I'm joined by 7 colleagues and friends from across the world who will introduce themselves, but we're missing today Dr. Zilu from the US and Dr. Thomas, who's a clinical scientist in Bristol, and they weren't able to join us today, but I will hand over to my colleagues, and we'll start with Dr. Ochoa to introduce herself.
Hello, hi. Thank you very much for the invitation to this. I am Carolina. I am a consultant urologist. My history is long. I'm from Colombia. Then I was trained in Barcelona. I did all my urology training in Barcelona. And then I found my passion for functional urology and came to the UK to have a 2 years fellow in functional urology when I learned all the techniques and I deepen all my learning in sacral neuromodulation. Thank you for inviting me.
Dr. Emre Huri.
Thank you very much, Hashim. Thank you so much for this invitation. It's again pleasure to be a part of this excellent neuromodulation course. I am Emre Huri. I'm the urology professor working at Hacettepe University in Ankara, Turkey. My most clinical side is in functional urology, neurourology. I know that, again, all participants will enjoy in our course. We invite all participants who are interested in the neuromodulation workshop. Thank you again.
Dr. Sahai.
Hi there, I'm Arun Sahai. I'm the current chair of the section of female urology in BAUS, and I'm a urological surgeon working at Guy's Hospital in London. I have several years experience of neuromodulation, and I'm honoured to be invited for the workshop. Thank you, Hashim, and look forward to seeing the esteemed faculty, many of our friends, and look forward to seeing you in ICS in Madrid for the workshop.
Dr. Arlandis.
Hi, thank you, Hashim, for inviting me to be part of this panel of experts. I'm urologist. I'm the current chair of the functional and reconstructive urology section in Hospital La Fe in Valencia, Spain. So you will come to my home, more or less, in Spain in the next days. I'm very happy for that. Well, and just from the beginning of my expertise in functional urology, in the late 90s, I was involved in sacral neuromodulation. So I'm very happy to share with you, all my knowledge and my expertise. So please come to this hands-on training. Will be very interesting for all of us.
And Dr. Averbeck?
So, thank you, Hashim, for the kind invitation. It's also an honor to take part in this workshop, and this podcast is very interesting to highlight the main areas that we'll be discussing in Madrid. And I'm very much looking forward to the ICS annual meeting there. I have a great expectation about this, and I'm just introduce myself. My name is Marcio Averbeck. I'm the head of neurourology at Moinhos de Vento Hospital in Porto Alegre, Brazil. And nowadays I'm currently the deputy chair of the ICS Standardization Steering Committee. So I'm very happy to be with my colleagues and friends as a speaker during the S&M workshop in Madrid.
Well, I just want to thank all of you so much for coming on and joining us for this podcast. And I think after your introductions, anybody listening will now be running to register, because we clearly have the leading experts in the field they're going to have an amazing experience learning from all of you. So I thank you so much. And so Dr. Hashim, can you just provide a little bit of detail about kind of, who might be interested in this workshop and who it's really targeted towards? What audience are you looking for?
Yeah, so we would be, so the workshop will be designed in such a way that it's mainly hands-on. There will be 9 stations. There will be 3 stations for percutaneous nerve evaluation, 3 stations for tined lead and full implant, and 3 stations for programming. So we take people through the whole pathway of sacral neuromodulation and teach on models. There will be models that we will be teaching on, and they will be able to insert needles into the models. They are excellent models. Some have been designed actually by Dr. Huri in his lab, and we will then rotate. The delegates would rotate between every station. So every 20 minutes they would rotate to one of the stations, so that everyone will be able to see the whole and learn on the whole pathway. The course itself is mainly is for anyone who's interested in sacral neuromodulation. Anyone who wants to start implanting, so urologists, gynecologists, nurse specialists, clinical scientists. So anyone who is able or wants to start sacral neuromodulation should really come to the course. It's an excellent introduction. And even those who are implanters and want to discuss difficult cases, how to manage difficult cases, then there will be the opportunity on the stations to discuss with the individual speakers and tutors on the course.
That's great. And it sounds like it's going to be both a workshop for those who are fairly new to sacral neuromodulation, who maybe want to start doing this in their practice, but then also for potentially, some of us, programming is not something that I do a lot of because I mostly do the implants. And so this is a great refresher for maybe practicing my programming, since that's not something I do as much of in my practice, as well as I think there are some people who, somebody who train but maybe don't do enough, don't do any P&Es or percutaneous nerve evaluations. Those aren't done, peripheral nerve evaluations. Those aren't done as frequently in some practices. So that's great that you kind of get this whole hands-on experience right from sort of the in-office to the OR, and then even like post OR, where you get to do some of the programming. So it sounds like it's really a course that's designed for really any level, and especially for those of us who maybe have been doing this and really have had some more difficult cases. This could be a chance to come and hear from the experts really about what your experience has been and what you guys have learned. So I think this is going to be a wonderful course. I think it's going to get sold out very quickly. So I would encourage everybody that is listening to this podcast to go and register for ICS, and then also to register for this course. Dr. Hashim, any other last minute sort of words of wisdom or advice or anything else you'd like to say about the workshop?
The workshop this is the second year we're running this workshop at the ICS, and last year was very successful, and that's why we're running it again. But we've actually been running this workshop for about 7 years at the European Association of Urology meeting every year, and it's always sold out. So I encourage people to register early, because it will sell out, especially with the new American Urology Association guidelines about recommending sacral neuromodulation even earlier on in the pathway for patients who don't want to take medications. So I think we will see more of this therapy being used, and I think this is the best time to actually start doing it and learn about it.
That's great. Well, thank you all so much for joining me today. I really appreciate it. And I'm really excited to see all of you in Madrid. So just as a reminder, the course is October 24th, Thursday. There's 2 sessions, one at 9:30 to 11, and then one from 11:30 to 1 p.m. And it's hands-on sacral neuromodulation with world-class experts, ideal lead placement. And you've had the opportunity to hear from the world-class experts today. And so thank you so much, all of you, for joining me, and looking forward to seeing you at ICS 2024 in Madrid.